give you a point that's wrong, they're asking you to pick the correct one. So based on that, it can confuse people. So it goes back to what is the question asking here? Like what's correct, what's wrong, what's the basis of the question. So ATI, you learn these subjects. So for example, right now we're doing reproductive screening. Right, we're learning about pelvic exams, pap smears, colposcopy, cervical biopsies, mammograms, STI screenings and testing. We're going to cover this today. So in that sense, if you understand how a pelvic exam is done, what's the purpose? What are they doing, right? Okay, they're going to palpate, possibly right, insert fingers, a speculum. We got to do this. They got to empty their bladder after. They got to watch for minimal bleeding. Like you understand a pelvic exam. So whether they ask you about pre-procedure, post-procedure, intra-preparation, instructions to go home, it won't matter. If you know a pelvic exam in and out, the question will be irrelevant. You can answer it. Does that make sense? That's the point of, I guess, how I lecture, or in the sense of why we go off the ATI book, is if you can understand the purpose and you can understand these exams, no matter what they hit you with, you should be able to answer the question because you understand the subject. Does that make sense? Okay? So that's the point to it. At the end of the day, I don't know what's on your comprehensives. I don't know what's on your proctors. I don't know what's on your exit. I don't know what's on your NCLEX. Okay? For sure on your NCLEX, no one does. And I think I mentioned this to you guys last week when we talked about this. Probably about half, at least a quarter for sure, if not more, of your NCLEX, you won't know what the hell they're talking about either. Okay? What they want to know is, given the information that you do have in front of you, can you make the logical, safe decision? Does that make sense? There's a lot of things out there that I didn't know what the hell they're talking about. But the answer was clear, like it was almost obvious, like don't do that. Make sense? So it's more so about reasoning, critical thinking, and engagement. That's what they want to see now. Because it's impossible for you to learn everything in a year or a year and a half. And then just like, you're gonna show up and like, I'm ready. Like, I got this. I can take care of a full assignment, no problem, no questions asked, I got it. That's unreal, that's never gonna happen. In a year, you're still gonna probably be iffy about many things. But as you continue, you will gain practice. No one's ignorant to that fact. But so what needs to be tested for you to be licensed is, can you make a logical, safe, competent decision should there be a situation? Can you point yourself in the right direction? Make sense? That's the goal. So understanding these safety precautions, these guidelines, that's what you're going to be tested on. Everybody on the same page? All right. Colposcopy, pre-procedure, again, informed consent, explain the procedure to the client. Intra-procedure, we're assisting them, right? Putting them in position, having the tools. Pre-procedure, again, the big thing is that informed consent, don't forget that it's required. Write it up there. Post-procedure, cervix is clean with normal saline solution. Provide clients with items for perennial care. Complications, what can go wrong? For one, hemorrhage, right? They can bleed out excessively. Monitor for heavy bleeding. Infection. Now, some of the things, and I might have mentioned this last week as well, a lot of the things we're gonna start, or I'm gonna point out, like this is something that's generic, meaning it applies all the same. I think I explained this to y'all, right? Like it's not gonna change. An infection is still gonna look like an infection. Whether it's in your kidney, in your bladder, in your ear, there's a few symptoms, whether systemic or local, that still always show up. Once it starts becoming more systemic or more severe, what's your body gonna do? What are you gonna spike? A fever. Nothing realistically, something that's super specialty and like severe. Majority of the times, a fever is only happening due to a infection. It's a body's response to slow it down. Okay? What else will be present? Or systemic or local? Huh? That's not Feeler, anybody? Feeler? What else shows up during infections? What will you see?
Warm to touch.
Redness, warm to touch, pain, possibly, but more important than that, purulent drainage. Don't think too much into it. You're looking at something, how do you tell? Just looking at it. Right? You don't look at somebody and know so much of their vitals, just look at something, what will you see? Fever, right? They're warm to touch, they're hot. Purulent drainage, foul smell, redness. This all points, right? Swelling. But the fever, foul smelling, drainage, those are your three key factors that something is infected. Okay? That's generic. And it doesn't matter if it's your pinky toe or your whole leg. You're still gonna see these factors. You're still gonna drain, right? The active infection. Or they're gonna start swelling, building it up inside. So that's regardless. Bleeding is another one. You can either be bleeding from your foot, from your hand, from your head, or from your abdomen, it don't matter. What will you see if someone's bleeding? That's true. So no blood. They're not bleeding. He's like, I'm bleeding. I got socked in the stomach. But you don't see the blood. Right? Tachycardia. Number one sign that someone is bleeding. Their heart rate will speed up. Okay? When they're going to shock, late sign, low blood pressure, hypotension, right? Pallor, lack of circulation, threading pulse. These are all signs that they are bleeding. This is how you have to think. If you're gonna write down and try to memorize every single thing you're reading, impossible, or very unlikely. But if you understand the concept, you will excel. Okay, because again, you're applying the knowledge to the question. You can't memorize. People who like go on Quizlet and just memorize the entire flashcards is pretty insane to me. Because then you're only limited to that. You know nothing else. You know how to answer that one question. But you have no idea for bleeding. And you see it on the field, and that's why the NCLEX board changed to the, what do they call it, the engine, right? New generation or whatever. New gen. Because they want to see, can you assess? I've seen the questions, they're great. Right? They give you like the whole medical record, pick the disease, the risk factors, what's happening. Like you have to put that together. That's great. Because then it really makes sure of like what can you be possible of. Make sense? So when going through this, keep this in mind. I'm not gonna be like, make sure they don't douche, right? And then on the test, like, make sure they don't douche. Like that's too easy. That's memory and recall. I don't need you to, I'm not playing goldfish. Okay? I don't need you to remember. I need you to understand. I'm gonna give you a question that I've never asked in the class, and with the logic that you've seen here, you should be able to put it together. That's the purpose here. And that really puts a strain on people, I've seen. Okay? So make sure you're understanding the concept, not memorizing. You should only memorize like certain key things that are applicable to that. But other things, generic, when I say it's generic, it's understanding. Okay? It's gonna always apply. Make sense? Alright. Let's move forward. What time is it? We came back at 9:25, 9:30, huh? All right, take a 10-minute break.